Welcome back to Calm Mind and Healthy Body, our channel. Today we're diving into a crucial topic affecting millions worldwide: blood clots. Understanding the signs and symptoms of a blood clot is essential for early detection and prevention of potentially life-threatening complications. In this video, we'll discuss the 8 critical signs of a blood clot, focusing on symptoms that may manifest in the legs, chest, and neck. Blood clots, or thrombosis, occur when blood thickens and forms a clump within a blood vessel. While blood clots play a vital role in stopping bleeding when we get injured, they can pose serious health risks when they form inappropriately within our veins or arteries. If left untreated, blood clots can lead to severe conditions such as deep vein thrombosis, DVT, pulmonary embolism, or even stroke. Recognizing a blood clot's early signs and symptoms is crucial for prompt medical intervention and preventing complications. Knowing these warning signs, you can proactively protect your health and well-being. Whether you're at risk due to a sedentary lifestyle, a recent surgery, or a family history of blood clotting disorders, staying informed about the symptoms can make a significant difference in your health outcomes. So stay tuned as we explore the 8 signs of a blood clot and empower you with the knowledge to safeguard your health. Remember, your health is your greatest asset, and being proactive can make all the difference. Let's jump right in. Understanding blood clots. Have you ever wondered what a blood clot is and how it forms in the body? In this segment, we'll explore the fascinating yet potentially dangerous world of blood clots, shedding light on their formation, types, and associated risk factors. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. Blood clot formation begins with a complex process known as coagulation. When a blood vessel is injured, the body initiates a series of cascading reactions to stop bleeding. Platelets, tiny cell fragments in the blood, rush to the injury site and clump together to form a temporary plug. Subsequently, a cascade of clotting factors triggers the conversion of fibrinogen into fibrin, a mesh-like protein that reinforces the platelet plug, forming a stable blood clot. There are 2 main types of blood clots: arterial and venous. Arterial clots typically form in the arteries and are often associated with atherosclerosis or plaque buildup. These clots can lead to heart attacks or strokes. On the other hand, venous clots occur in the veins and are more common, with deep vein thrombosis, DVT, being a well-known example. If a venous clot dislodges and travels to the lungs, it can result in a life-threatening pulmonary embolism. Several risk factors can predispose individuals to blood clots, including prolonged immobility, surgery, smoking, obesity, hormonal contraceptives, and genetic factors. Awareness of these risk factors and understanding the mechanisms of blood clot formation can empower you to take proactive steps to mitigate your risk and safeguard your health. Stay tuned for more insights on blood clots and how to protect yourself from their potential dangers. Symptoms in legs. Blood clots can form in the legs, a common site for potentially dangerous clots. In this segment, we'll explore the specific signs and symptoms that may indicate the presence of a blood clot in your legs, emphasizing the importance of early recognition and prompt medical attention. One of the most common symptoms of a blood clot in the legs is swelling. One leg appears noticeably more significant than the other, accompanied by a feeling of tightness or heaviness. Additionally, pain or tenderness in the affected leg, especially when standing or walking, can be a red flag for a potential blood clot. The skin over the clot may also feel warm and appear reddish or discolored. If left untreated, blood clots in the legs can lead to severe complications such as deep vein thrombosis, DVT, or even a pulmonary embolism if the clot dislodges and travels to the lungs. DVT can cause long-term damage to the veins, chronic pain, and in severe cases, limb-threatening conditions. Knowing when to seek medical help for leg symptoms suggestive of a blood clot is crucial. If you experience sudden or severe leg pain, swelling, redness, or warmth, especially if accompanied by difficulty breathing, chest pain, or coughing up blood, seek immediate medical attention. Remember, early detection and intervention can significantly reduce the risk of complications associated with blood clots in the legs. Stay vigilant, listen to your body, and prioritize your health and well-being. Symptoms in chest. Blood clots that form in the chest area can pose a significant threat to your health and well-being. In this segment, we'll delve into the signs and symptoms that may indicate the presence of a blood clot in your chest, highlighting the importance of swift action and medical intervention. One of the hallmark symptoms of a blood clot in the chest is chest pain. This pain may feel sharp, stabbing, or pressure-like, and can worsen with deep breathing or coughing. Additionally, Experiencing sudden shortness of breath, especially with minimal exertion, can be a warning sign of a potential pulmonary embolism, where a blood clot travels to the lungs. Coughing up blood, known as hemoptysis, is another concerning symptom that warrants immediate medical attention. Addressing chest symptoms promptly is crucial when it comes to potential blood clots. Chest pain, shortness of breath, and coughing up blood are all red flags that should not be ignored. If you experience any of these symptoms, seek medical help immediately to rule out a blood clot in the chest. Diagnosing and treating chest blood clots typically involves a combination of imaging tests such as CT scans, blood tests, and medications to prevent further clot formation and reduce the risk of complications. Timely intervention can be life-saving in cases of pulmonary embolism, underscoring the importance of recognizing and acting on chest symptoms associated with blood clots. Stay informed, stay vigilant, and prioritize your health regarding potential chest-related concerns. Symptoms in neck. While blood clots in the neck are less common than those in the legs or chest, they can still present serious health risks that should not be overlooked. In this segment, we'll explore the less common but critical signs of blood clots in the neck, emphasizing the importance of recognizing these symptoms and taking proactive steps to safeguard your health. One of the key symptoms of a blood clot in the neck is neck pain that may feel sharp, throbbing, or persistent. Swelling in the neck area and tenderness to the touch can also indicate a potential clot. Additionally, experiencing difficulty moving your neck or stiffness unrelated to a muscle strain or injury could be a warning sign of a blood clot. The risks associated with neck blood clots include the potential for the clot to dislodge and travel to the brain, leading to a stroke or other serious complications. Recognizing and addressing neck symptoms promptly is crucial to prevent such outcomes. Adopting preventive measures and lifestyle changes can reduce the risk of neck clotting. Staying hydrated, maintaining a healthy weight, and avoiding prolonged periods of immobility can help promote healthy blood circulation and reduce the likelihood of clot formation in the neck. Regular exercise, proper posture, and avoiding smoking can also contribute to overall vascular health and lower the risk of blood clots in the neck. Prioritize your health, listen to your body, and seek medical attention if you have concerns about neck-related symptoms. Prevention strategies. Preventing blood clots is critical to maintaining optimal vascular health and reducing the risk of potentially serious complications. In this segment, we'll share actionable tips and strategies for lowering your risk of blood clots through lifestyle changes and proactive measures. One of the most effective ways to prevent blood clots is to incorporate regular exercise into your routine. Physical activity improves circulation, helps maintain a healthy weight, and reduces the risk of clot formation. Aim for at least 30 minutes of moderate exercise most days of the week to keep your blood flowing smoothly. Making healthy diet choices can also significantly reduce the risk of blood clots. Opt for a diet rich in fruits, vegetables, whole grains, and lean proteins while limiting saturated fats and processed foods. Consuming foods high in omega-3 fatty acids, such as fatty fish, can help reduce inflammation and promote heart health, lowering the risk of clotting. Staying hydrated is essential for maintaining optimal blood viscosity and circulation. Drink plenty of water throughout the day to keep your blood flowing smoothly and prevent dehydration, which can increase the risk of clot formation. Additionally, avoiding prolonged periods of immobility, such as sitting for long hours without movement, is crucial for preventing blood clots, especially in the legs. Consider incorporating stretching, walking breaks, or leg exercises into your daily routine to improve circulation and reduce clotting risks. Compression stockings can also help promote healthy blood flow, particularly during long periods of sitting or standing. Treatment options. When managing blood clots, timely and appropriate treatment is essential to prevent complications and promote recovery. In this segment, we'll explore the diverse treatment options available for blood clots, ranging from medical interventions to surgical procedures, and emphasize the importance of following your healthcare provider's recommendations for optimal outcomes. One of the primary treatments for blood clots is anticoagulant medications, also known as blood thinners. These medications work by inhibiting the clotting factors in your blood, preventing the formation of new clots, and reducing the risk of existing clots growing larger. Common anticoagulants include warfarin, heparin, and newer oral anticoagulants like rivaroxaban and apixaban. Surgical interventions may be necessary in cases where blood clots are large or causing severe symptoms. Your healthcare provider may recommend procedures such as thrombectomy, where the clot is physically removed from the blood vessel, or a vena cava filter placement to prevent clot migration to the lungs. Following your healthcare provider's recommendations is crucial for successful clot treatment and recovery. It's essential to take your medications as prescribed, attend follow-up appointments, and promptly communicate any changes in your symptoms or health status. You can optimize your chances of a positive outcome by actively participating in your treatment plan and maintaining open communication with your healthcare team. After clot treatment, the recovery process may vary depending on the severity of the clot and individual factors. With proper treatment, adherence to medical advice, and a proactive approach to your health, you can navigate the recovery process and reduce the risk of recurrent blood clots. We must reflect on the key points we've covered to empower you with the knowledge and awareness needed to protect your vascular health. To stay updated on critical health-related topics and continue your journey toward optimal well-being, we invite you to subscribe to our channel for more informative content. By taking action and staying engaged with valuable health information, you can empower yourself to make informed decisions and prioritize your health for a vibrant and fulfilling life. Thank you for joining us, and remember, your health matters.